Mansur, Dalal of Common Age, the only association for aging across the Commonwealth. And Diana, it resonates, your memories and vision that you said resonates with me so much, really, honestly. And I'm very quickly going to ask the question, I understand that. But my grandfather was 90, expired at the age of 94. He did his PhD at the age of 89, and in Persian poetry. I'm from India. And for me, that's a memory that he had. And my vision was that how can I make such elders live in comfort? And that's how my journey started more than 21 years back. My question is that though we are an associate for the aging, our ethos, our drive is multi-generational. And that's what we push. We even have a youth chapter across the associate for the aging. We are very much pushing for a healthy aging agenda across the Commonwealth. In fact, a report is going to be launched this Wednesday. My question is, how do we integrate healthy aging across generations under the health justice agenda that you have to promote the cause of climate change, but with identifiable markers along with healthy aging?
Well, great question, and I do believe a lot of us agree with you in terms of that memories and vision resonating. That might also bring in Dr. Hospodale, since he also mentioned health justice. So I don't know who would.
I don't know why you're deferring to me. No, the very important point you're bringing. The whole world is aging. The world is in a situation it's never been before, where increasingly people are older. This has not happened in human history. I think several countries are now at a point where more people are older than 40 or 50 than are younger than 40 or 50. So we do have to be much more proactive in looking at that and what it means from climate justice, health justice. So I'll use my country, Trinidad and Tobago. There are 154 homes for the elderly. There's an association of homes for the elderly. That's the registered homes. There are a lot that are not registered. Those that are registered have systems whereby public health inspects them. So one of the things we're working on is how do you add climate resilience to that inspection system? Is the roof painted white so it'll reduce the temperature inside by a few degrees? Are there trees planted for shade? What about the evacuation plan in the event of a flood? Is there a room in the building that's cool with air conditioning so when it gets wicked hot, people have somewhere they can retreat? So that's a practical example of trying to integrate that. But healthy aging, which you talk about, actually begins from young. And it corresponds to a lot of the other things that are causing health problems in the society. Excess use of alcohol, tobacco use, lack of, etc., poor diet.
NCDs. So
if the NCDs, in short, if we address those things, we help a lot with healthy aging. We help a lot with a more productive workforce, and so on and so forth. So it'll be interesting to talk some more about the point that you have brought up, sir.
And I certainly believe that the narrative also needs to change. There are some societies that respect their elders and they hold on to what their elders mean. And then there are a lot of growing societies where we believe because they're old, they should just stay in a corner. We forget that these are people and that they still have dignity. And so I think even as we speak about these systems, we need to go back to the values of treating every citizen from birth all the way to death with tenderness and compassion and empathy and dignity. So I just thought I would include that. Thank you.